Welcome to another episode of Curiosity Homes, where your curiosity is the limit. Today, we will discuss what is seeds, causes of seeds, what are the risk factors, preventions, and studies related to seeds. Sudden infant death syndromes or SIDS is the sudden, unexplained death of an infant younger than 1 year old. Some people call SIDS crib death because many babies who die of SIDS are found in their cribs. Statistics show that SIDS is the leading cause of death in children between 1 month and 1 year old. Most SIDS deaths occur when babies are between 2 months and 4 months old. In the United States alone, 6,000 to 7,000 babies die of SIDS every year. One of the leading hypotheses that could explain SIDS is infant development, as it may reflect a delay or abnormalities in the development of the nerve cells within the brain that are critical to normal heart and lung function. Recent examinations of the brainstems of infants who died with a diagnosis of SIDS have revealed a developmental delay in the formation and function of several serotonin-binding nerve cell pathways within the brain. These pathways are thought to be crucial to regulating breathing, heart rate, and blood pressure responses during awakening from sleep. What are the symptoms of SIDS? Almost all SIDS deaths happen without any warnings or symptoms that occur when the infant is thought to be sleeping. What causes SIDS? A combination of physical and sleep environmental factors can make an infant more vulnerable to SIDS. These factors may vary from child to child. Examples are the following: brain abnormalities, low birth weight, respiratory infections. Some of sleep environmental factors are as follows: sleeping on the stomach or side. Babies who are placed on their stomach or sides to sleep may have more difficulty breathing than those placed on their back or the supine position. Sleeping on a soft surface, lying face down on a fluffy comforter or a waterbed can block the infant's airway. Draping a blanket over a baby's head also is risky. Items that is included in the crib baby just like teddy bear, pillow, additional caution can also pose risk for sudden infant death syndrome. Sleeping with parents. While the risk of SIDS is lowered if an infant sleeps in the same room as his or her parents, the risk increases if the baby sleeps in the same bed, partly because there are more soft surfaces to impair breathing. So it is recommended that the baby will be put in the separate bed or crib to decrease sudden infant death syndrome. Although sudden infant death syndromes can strike any infant, researchers have identified several factors that may increase the baby risk. They include the following: sex, age, race, family history, secondhand smoke, and being premature. These are the following maternal factors or the factors that is contributing to SIDS because of the mother condition. During pregnancy, the risk of SIDS is also affected by mothers, especially if she has the following situation. If younger than 20-year-old, smokes cigarettes, uses drugs or alcohol, has inadequate parental care. What are the prevention of SIDS? There is no guaranteed way to prevent SIDS, but we can help your baby sleep more safely by following these steps. 1. Place your baby on their back to sleep in a cot or in a room with you. Don't smoke during pregnancy or let anyone smoke in the room or in the same room as your baby. Don't share a bed with your baby if you or your partner smoke or take drugs, or if you have been drinking alcohol. Never sleep with your baby on a sofa or armchair, as it will increase the seeds. Don't let your baby get too hot or too cold. Keep your baby's head uncovered. Their blankets should be tacked no higher than their shoulders. Place your baby in the feet to foot position with their feet touching the end of the cot or the pram. If possible, breastfeed your baby. To summarize everything, watch this video.
Sudden infant death syndrome, or SIDS, which is also known as cot death or crib death, is the sudden and unexplainable death of an infant during their first year of life. Because of the seemingly random nature of this condition, there are a number of risk factors that seem to correlate with getting SIDS, but there's no clear mechanism or cause that's been identified. SIDS is considered a diagnosis of exclusion, meaning all other causes have to be ruled out before an infant death is given that label. The most well-known risk factors have to do with how an infant sleeps. To lower the risk of SIDS, the recommendation is to make sure that babies sleep alone in a crib, on their backs, and without blankets. The risk of SIDS is higher among boys rather than girls, as well as infants between 2 and 4 months old, and among formula-fed babies, and those born prematurely or with low birth weight. Risk factors that relate to a mother include receiving little or no prenatal care, being a teenage mother, and smoking during the pregnancy. Alcohol consumption is also thought to be a risk factor, because there are more cases of SIDS during weekends, the New Year, and other times of the year when drinking is included in celebrations. The fact that far more boys die of SIDS than girls shows that there is a level of genetic susceptibility at play, but the exact specifics are unclear. A minority of SIDS-related deaths show a correlation with genetically inherited channelopathies, which are defects in ion channels that affect a variety of tissues, including the heart. Another possible genetic link is the higher incidence of SIDS in babies with gene mutations involved in the autonomic nervous system. These clues, though, are still being researched, and no exact gene or combination of genetic defects has been identified. SIDS is generally thought to happen in children that have a genetic susceptibility which is then triggered by external factors. An epidemiologic clue is that Native American infants have the highest rates of SIDS, while Asian infants have the lowest rates of SIDS. Cultural practices around sleep, though, might also play a role, and so it makes it hard to tease apart genetic and environmental factors when it comes to race. A diagnosis of SIDS can only be made following an autopsy, to make sure that there isn't an alternative explanation for an infant's death. For prevention, unfortunately, because the underlying cause of SIDS is usually unknown, there's no surefire way to prevent it. Alright, as a quick recap, sudden infant death syndrome, or SIDS, is a diagnosis of exclusion given to an infant that dies of unknown causes, and is most common in infant boys between 2 and 4 months of age, but can happen anytime in the first year of life. To minimize the risk of SIDS, infants should be put to sleep on their back, should not be exposed to cigarette smoke, and should be breastfed if possible.